And with us now from Burlington, Vermont, the former governor of that state, Howard Dean, who is also the former head of the Democratic National Committee, and, in case you forgot, a medical doctor. Though he doesn't practice anymore, his wife still does. Governor, thank you for coming this morning. Let's go right in on to start with this public option. You have said, you just heard what the two senators said, but you have said that health care reform without this so-called public option is no reform at all. It would be worthless. Why so?
It's true. And what I see, the co-ops proposal, and Kent Conrad is somebody I consider a great friend and a great senator, but that proposal is a political compromise, not a policy compromise. Nobody knows what it would look like, and when it's been tried in the past, it mostly hasn't worked. There's one or two successful examples of it, but they don't have market strength. The last time we tried it was Blue Cross. They've now been eaten up by the private health insurance industry. So this is a proposal that's great in the Senate when you're talking about bipartisanship, but there's nothing to it, I don't think. Here's what the public insurance option does. It looks like Medicare or something like it. There'll be some changes. But the reason people need that choice is because right now private health insurance industry, for-profit, is incredibly inefficient. Not because the private sector is by nature inefficient, but because they are investor-owned, and a huge proportion of the money they take in has to go to return on equity. That is all money that's not spent on health care. So let's just suppose you're one of the big health care companies, and at the very best, you're going to have about an 80% payout ratio. That means that 20% of all the money you take in goes to some cause other than health care. In Medicare, 96% of all the money you take in goes to health care. It is by nature much more efficient. It doesn't kick you off if you get sick. It doesn't stop you from getting insurance if you get sick. You don't lose it if you lose your job. You can get it back. You don't have to worry about getting it back if you get your job, and you can move anywhere in America and still have the health insurance. That is a choice that I think most Americans would welcome. Everybody over 65 has it, and the question is, why don't we open that program up to people under 65?
Who pays for it, Governor?
Taxpayer. Well, the proposal will be that the taxpayers will pay a subsidy for people who need the help buying insurance, but they can use that subsidy either to buy private insurance or public insurance as they choose.
And what about employers who now share the cost of Medicare? Would they have to share the cost?
Large employers would either share the cost or keep the system the way it is. Most large employers have said they like the system the way it is. Small employers are off the hook. One of the great things about the Dodd bill and the House bill is that small employers no longer have to have a responsibility for getting health insurance for their employees. Now, small employers create 80% of all the new jobs in America. Lord knows we need some jobs these days. What a great boost to the people who create the most jobs in America, the small business community.
You just heard both Senator Grassley and Senator Conrad didn't say this, but I think it was interesting in that he really didn't address it. Senator Grassley says he's getting mixed signals from the White House on exactly what the president wants here. Do you think the president has to get more specific if he's going to get this passed?
Well, let me just be fair about this. We're getting pretty mixed signals from Senator Grassley. I did not hear one time Senator Grassley say what he would vote for. There's a lot of talk about bipartisanship, but when he was in Iowa all last week, he was basically letting people know that he didn't think he could vote for any bill that couldn't get the support of his Republican caucus and Republican leadership, and that clearly has not been forthcoming. So I think we can discuss what the president's messages be, but I think the Republicans owe it to this country to give us a much clearer message about what they'll support and what they won't support.
Well, just for example, though, isn't the president, do you think he's going to have to get more specific on whether or not it is absolutely mandatory to have this public option in here, so the Congress, members of Congress, will know what they can vote for and what they don't want to get that limb sawed off behind them, as you know.
I agree with that. I agree with that. I think the president clearly knows that a public option, a public insurance option, is necessary for real reform, to give the American people real choice, not the kind of choice that Senator Grassley was talking about between one private health insurance company that's going to squeeze you and another private health insurance company that's going to squeeze you. We'd like to give them a real choice. Secondly, I think the president probably has given some very strong signals to people behind the scenes, but the president knows he needs a bill out of the Senate. I think the president would like to get a bipartisan bill. He knows that's increasingly unlikely, as he said in the last at the end of the last week or so. And but he's going to work the legislative process as he sees fit. So I leave it to him to figure out what signals he has to send. I'm not going to be critical about him on that.
Did you think the time has come for him to say, look, I'm not going to get anything from the Republicans anyway, so I better just concentrate on getting the Democratic votes and just put the Republicans aside?
Well, I think that's why we're waiting for the signal from the Republicans about. They seem right now to be mostly interested in stalling. Chairman Baucus has set a date for September 15th. I think we're going to know a lot more on that date.
What about this whole idea of the cost of this? Both Senator Grassley and you heard Senator Conrad say it's going to have to be pared down considerably if it's going to have a chance of passage. What do you think is a good number? What do you think is realistic here?
Well, I'd say two things about that. First of all, the House bill was scored at $600 billion. That's a pretty good number. That's $60 billion a year, is less than we're spending in Iraq and Afghanistan. So I think if we can spend that kind of money in Iraq and Afghanistan, we can probably spend that kind of money to make sure that every American has cost-efficient health care that they can never lose as long as they pay their share of the premiums. So I think that's a pretty reasonable number. I know that the Senate Finance Committee has been talking about higher numbers. I think if they get their number down to where the House number is, that's pretty good.
What about this whole thing about pulling the plug on grandma? You heard Senator Grassley talk about that, and Senator Grassley said this morning, and we should add that he is a very key person on if there is going to be a bipartisan approach, because he's the ranking Republican on the Finance Committee. He said this morning that yes, in fact, this bill would not pull the plug on grandma, but he said a lot of people thought it would, and that's why he said we can't let anybody pull the plug on grandma. Where did all this come from?
Well, it came from the far right talk shows and so forth and so on. But the irony of all this is my understanding is something very similar to what they're talking about is already law in Medicare, and Senator Grassley, when he was in the majority, supported that law, which is end-of-life counseling. That is the law for Medicare. That's permitted under Medicare. It's not mandatory, but it's permitted. And it's also one of the issues that seniors care the most about. They want end-of-life counseling. How you can morph end-of-life counseling into, so all the House did was essentially repeat the same thing that Senator Grassley voted for in 2003 in their bill. Now, how you can morph that into pulling the plug on grandma, I don't know. I think it's despicable. I think it's awful that the lies that have come out on this bill that just designed to frighten the daylights out of people. But I think the American people is much smarter than politicians in Washington give them credit for, and they're going to figure this out. And they know that they really do want health care reform.